Hi, everyone, and welcome to today's WALPIN webinar. I'm Marcy Hubbs, the manager of Well Ahead Louisiana's Provider Education Network, or what we call WALPIN. Thank you so much for joining us today. First, I'd like to go over some general information before getting started. This webinar will be recorded and posted to www.walpin.org following the presentation. An email, including the link to this recording and all the materials presented during today's webinar, will be sent to all that registered for the webinar. This email will include a brief evaluation, so please take the time to provide feedback to help direct future webinars. If you do have any technical difficulties during the webinar, please type a message in the chat box and we'll do our best to address them. And please hold all content-related questions until the end of the webinar. We have a designated time following the presentation to allow for Q&A. At this time, during the Q&A session, you may type any questions in the chat box and the presenter will read and address your questions. So let's get started. We bring today's webinar on self-measurement of blood pressure is presented by Chelsea Morgan of the American Heart Association. Chelsea is the Community Impact Director for the Louisiana Capital Area with a reach that expands across the state. In this role, she works directly with corporations and community leaders to provide resources that impact systems, conversation, and policy change. Chelsea's focus is to address the social determinants of health identified in the recent Community Health Needs Assessment. In 2018, her work to incorporate mission, health initiatives, and life-saving messages into fundraising events and all the work she does gained her recognition on a regional level by being awarded the John DeLuca Award from the American Heart Association. We are so happy to have her share her knowledge with us today. Please welcome today's presenter, Chelsea Morgan.
Thanks so much, Marcy. So as mentioned, we're going to chat about using self-measured blood pressure to manage uncontrolled hypertension. And we like to start most presentations with a reminder of our mission: to be a relentless force for a world of longer, healthier lives. We can definitely work towards more healthy life expectancies if we focus on the social determinants of health and how to better manage chronic conditions like hypertension. To support you in your practice, the American Heart Association has many national partnerships and tools. 3 outpatient service programs are available to help you and your patients manage their chronic disease, high blood pressure, high cholesterol, and type 2 diabetes. Now more than ever, it is important to manage these chronic conditions as they are also all potentially underlying risk factors for coronavirus. Today, we are going to focus on hypertension and the importance of self-monitoring and uncontrolled hypertension, but we hope to leave you with more resources and action steps, especially as we recognize that some of your work has shifted to telemedicine. Target BP is a national collaboration between the American Heart Association and the American Medical Association to reduce the number of Americans who have heart attacks and strokes by urging medical practices, health service organizations, and patients to prioritize blood pressure control. Recognition may be provided to healthcare providers who obtain high levels of blood pressure control. Target BP is just a program, not just a program we are implementing, rather it's an opportunity and an imperative. Blood pressure control rates change nationally from 48% to 70% and beyond. By doing that, we can truly be a part of saving lives from heart disease and stroke. Target blood pressure launched in response to a growing body of evidence that shows high blood pressure is a contributing factor to many health conditions. Left undiagnosed or not managed, it can lead to strokes, heart attacks, kidney failures, and other disease consequences. Many of the more than 100 million American adults who have high blood pressure don't know because it doesn't often have any symptoms. By joining Target BP, you will have access to online tools and resources, including the Target BP Improvement Program, to help physicians and care teams by offering access to the latest research, tools, and resources to reach and sustain those blood pressure control rate goals within the patient populations that you serve. The BP Improvement Program uses team-based approach where data drives improvement. Clinicians utilize quality improvement metrics to monitor the impact of those efforts. The BP Improvement Program has three main components which can be remembered using the MAP framework. The acronym MAP stands for Measure Accurately, Act Rapidly, and Partner with Patients, Families, and Communities. Under Measure, there'll be skills checks and e-learning modules with a lot of provider education materials. Acting rapidly can sometimes mean clinical algorithms and EHR system changes. And of course, partnering with our patients and families and communities means those self-monitoring blood pressure systems, education materials, and linkages in our community. Here are two examples of the many resources that are available, but I believe the greatest benefit of Target BP is the continuing education. Here is a great example of the online webinars that are available for CME credit. We will now watch part one of one of those webinars to tell you more about self-monitoring blood pressure and things to now do to set up your program.
Please stand by. Good day, everyone, and welcome to this Target BP webinar using self-measured blood pressure monitoring to diagnose and manage high blood pressure. All lines will be muted during today's webinar. Today's call is being recorded. At this time, I would like to turn the call over to Amy Cherokee, HBP Strategic Alliance Manager at the American Heart Association. Please go ahead.
Hello, and welcome to today's Target BP webinar. On behalf of the American Heart Association and the American Medical Association, I want to thank you for taking time out of your busy schedule to join us. As mentioned, today we will walk through the technique of using self-measured blood pressure monitoring to diagnose and manage high blood pressure. Presenting on today's webinar is Linda Murakami, who is the Senior Program Manager for Quality Improvement, and Lakin Burkowski, an Improvement Advisor, both with the American Medical Association. A few housekeeping items. The webinar is being recorded. To minimize background noise, all participants have been placed on mute. Please submit your questions through the ReadyTalk webinar Q&A chat feature throughout the presentation. Our speakers will save questions and answer them all at the conclusion of our presentation. So with that, let's jump right in. Our first speaker is Linda Murakami, and she is one of our Target BP experts in nursing in the healthcare field. Take it away, Linda.
Thank you, Amy, and thank you everyone for joining us today. This slide lets you know that neither Lakin or I have any disclosures. And here are the objectives we plan to cover today. Explain the benefits of using self-measured blood pressure, list patients for which SMBP is indicated, demonstrate how to train patients to self-measure their blood pressure, explain how to interpret SMBP readings, and describe how to set up an SMBP program in your practice. So let's get started by discussing what self-measured blood pressure, or SMBP, is and how it's beneficial. SMBP is when patients perform their own blood pressure measurements outside of the clinical setting. It's beneficial because they're able to better predict future cardiovascular events as opposed to standard office blood pressure. We'll talk later about communication, but you always want to make sure your patient has instructions on how to get the results of the readings to the office. And always make sure the patient knows what to do if they get readings that are dangerously out of range such as calling the office, going to an urgent care, or instructing them to go to the ER if it's after hours. So let's talk about why you use SMBP in practice. In order for SMBP to be beneficial, it's best when it's paired with clinical support, and there's a process for clinicians to receive the SMBP readings from the patient. SMBP works to improve blood pressure even when just used alone. And there's evidence to support that. But there's even stronger evidence telling us that when SMBP is combined with additional support, it can be even more effective in improving blood pressure. Additional support includes counseling, providing patients with education about hypertension and their medications, or even communicating online through the patient portal regarding their blood pressure results and providing guidance. These actions help SMBP work even better. There are a few ways that SMBP can be used. First, it's accepted as an out-of-office method to confirm a diagnosis of hypertension. It's also used to monitor the effectiveness when titrating medications, especially in conjunction with telehealth counseling or other clinical interventions. Next, SMBP is used for patients who are placed on antihypertensive medications for the first time. Again, this should also be combined with additional strategies like telehealth and team-based care to increase effectiveness. The evidence for this is included in the 2017 American College of Cardiologists and the American Heart Association Hypertension Guidelines. SMBP is used to confirm whether elevated blood pressure readings found in the office setting also occur outside of the office setting. If the patient's not been diagnosed with hypertension, these out-of-office readings will assist in confirming the diagnosis. Patients with a diagnosis of hypertension who still have elevated blood pressure in the office and also at home with SMBP are considered to have sustained hypertension and likely will require additional interventions. High readings in the office and normal readings using SMBP may indicate white coat hypertension. And then the opposite's true if patients have normal blood pressure readings in the office setting, yet are high and out of range when outside of the clinical setting using SMBP. These suggest the patient may have masked hypertension. So here's how SMBP improves the maintenance of blood pressure. In 2015, the Australian expert consensus published that home blood pressure measurement can help assess the antihypertensive treatment that's being used. The study found that therapy guided by home blood pressure measurement compared to usual care based on office blood pressures. It led to significantly more patients achieving blood pressure control and a larger blood pressure reductions. When we talk about assessing control across a 24-hour period, SMBP offers the opportunity to assess treatment effects at different times of the day and over extended periods of time. The convenience of SMBP for patients is particularly helpful for repeated measurements. And treatment decisions are based on the average of the series of readings taken. Patients taking their blood pressure should be informed that blood pressures may vary between measurements and not to be alarmed with high or low results on a single occasion unless the results persist or are associated with clinical symptoms like chest pain or shortness of breath. SMBP has advantages of engaging and empowering patients in the management of their own blood pressure. In patients with a diagnosis of hypertension, patients take part in their own blood pressure management just by monitoring their blood pressure. So when they follow the treatment plan and take their meds and watch their diet, they'll see improvements in their blood pressure readings. But they'll also see their readings get worse if they decide to stop taking their meds, which we hope inspires them to get back on track. So as I mentioned previously, SMBP is useful in diagnosing suspected hypertension, white coat, and masked hypertension. The 2017 ACC-AHA hypertension guidelines provides us guidance on that. So for the patients with suspected white coat hypertension, you'll look at adults with an untreated systolic blood pressure greater than 130 millimeters of mercury, but less than 160. And a diastolic blood pressure greater than 80 millimeters, but less than 100 millimeters of mercury. And for the patients with suspected masked hypertension, you'll look at adults with untreated office blood pressures that are consistently between 120 and 129 millimeters of mercury for systolic and between 75 and 79 millimeters of mercury for their diastolic blood pressure. We touched earlier on how self-measured blood pressure can increase patient engagement. And we also discussed how it can be used to monitor the effects of any changes to the treatment regimen, such as increasing med doses, adding medications, or even when the patient implements lifestyle changes, such as diet and exercise. Patients and providers benefit from seeing the direct effects of these interventions through the SMBP readings. The 2017 hypertension guidelines suggest using SMBP to determine if treatment-resistant hypertension is present for patients with difficult to control blood pressures. A study done in 2011 with over 8,000 patients found that about 37% of patients thought to have treatment-resistant hypertension actually had white coat hypertension after having these out-of-office blood pressure monitoring measurements performed. And this is important because misdiagnosis could lead to overtreatment with the potential for patient harm. So here's a few barriers that are common concerns. Providers are concerned about the cost of the devices for the patient, but also the cost of unreimbursed time to train the patients on SMBP and review the results. Using allied health members of the office team can reduce that cost incurred for training patients. And many clinicians also verbalize they're not aware of protocols for SMBP, which is why we're working to provide those resources online to providers and their teams. There are resources available to teach clinicians how to train the patients. Health literacy comes into play with provider concerns about valid data, measurement technique, use of validated devices, and patients cherry-picking the results to provide back to the office. Again, proper training protocols and use of validated devices with memory can help alleviate some of these barriers. Let's talk about some things to consider when starting an SMBP program. It's always preferred to have the clinical team work together to make changes to the organization's processes. But you always need to identify someone to champion the efforts of the team. Many times it's a physician, but can be any other provider who has decision-making authority to move suggested changes through the practice. We mentioned here budgeting for loaner devices. Financial consideration will be needed on behalf of the practice to set up a loaner program. This is when the practice will buy home blood pressure devices that they'll keep on site and loan to the patients. This program helps where patients who may not be able to purchase their own device can still benefit from performing SMBP for a shorter period of time. It also benefits those patients the provider is working up and ruling out a diagnosis, so they don't have to commit to purchasing a device if it's determined they don't have hypertension. So the times here are approximate, but this will give you an idea of how much time to build into the program. So you'll want to allocate time for the following: training staff about an hour, training the patients, maybe 5 to 6 minutes per patient, ensuring device accuracy if the patient uses their own device, about 5 minutes, averaging and documenting patients' SMBP readings, about 5 minutes, and preparing the device for the next patient if implementing a loaner program is 5 minutes. This is the time that actually will use to check the device was returned in working order and to disinfect the device for the next patient. Here are some additional things to consider so you can allocate the work involved among your clinical team. Not all patients will need to use SMBP, so you'll want to create a process to identify them, those patients who need to use it. Also consider when the patient is willing or able, or whether the patient is willing or able to do the measurements. Next, select your trainers from the team and make sure there's consistency on how the patients are taught to perform SMBP. Also, make sure you create a process for the patient to communicate the readings and any other concerns to the office and how to manage the return of any equipment. Usually the staff member receiving the readings from the patient will average and document the readings and notify the provider who's in charge of titrating medications of the results. Also, the timing for scheduling follow-up depends on the length of time you're having the patient perform SMBP, as well as what the results are. So as they're communicating results to you, you may have them keep it for longer in an effort to get more results. Lastly, loaner programs need to be sure that equipment is disinfected following the CDC's guidelines for cleaning small equipment. Plus, you'll need to delineate spaces for dirty and clean devices so they don't cross-contaminate when brought back to the office. When building your program, know that patients with a confirmed diagnosis of hypertension should be encouraged to purchase their own validated SMBP device. Your patients without a confirmed diagnosis of hypertension should perform SMBP when you suspect they might have it. And those who cannot afford their own device should be offered a loaner device if you've set up the program to do so. You want to train the staff to measure your patient's mid-upper arm circumference to ensure the accurate cuff size is purchased or used. The incorrect cuff size is the #1 error when performing blood pressure measurement, so make sure to help the patient choose the right device. You need also to instruct the patient to buy a validated, automated upper arm blood pressure device, preferably one with memory and averaging. The technology on devices now also includes Bluetooth capability that transfers the readings from the blood pressure monitor to your smartphone. But keep in mind that these might cost more money. But also, do not recommend or have the patient use a wrist cuff unless it's impossible to do brachial readings with an upper arm cuff. And never use finger devices because they are not accurate. When a patient does purchase their own device, make sure they bring it into the office to test the accuracy. Blood pressure devices purchased for SMBP need to be checked for accuracy even if they pass an accepted validation test. Some may not provide accurate readings in every patient, and accuracy testing is done in the office by taking multiple readings using the patient's blood pressure monitor and the office standard method of blood pressure measurement. Differences of less than or equal to 5 millimeters of mercury when averaged are considered acceptable and make the device safe to use. Accuracy testing should be done after the purchase of the device and then annually. There's guidance on the targetbp.org website on how to perform the accuracy checks.
So that was just part 1 of the CME approved module. We hope that was helpful and we'll continue to share more resources with you. As you know, high blood pressure can be unreliably diagnosed, but always reliably diagnosed by a healthcare professional using a blood pressure monitor. Once diagnosed, it can't be cured, but it can be controlled, which requires nearly daily attention. A simple blood pressure check is the first step in preventing damage. Many factors can attribute to misdiagnosed blood pressure. You may be surprised to hear that less than 10% of blood pressure readings are measured accurately. This is in the clinical setting and through self-monitored blood pressure programs. One more time, less than 10% of blood pressure readings are measured accurately. As mentioned during the video, it is important to have the right cuff size. I find that this is the most common way that hypertension is misdiagnosed. As a reminder, we encourage you to ask patients if they've completed this checklist before measurement. These may be good to include in your reminders for their telemedicine appointments. A full bladder can throw the blood pressure reading off 10 millimeters of mercury. I'm now going to measure my own blood pressure to show you how easy SMBP can be if the patient is provided the resources via a loaner or self-purchase. For many people, the place they are most at ease is at home. So that may be the bright side to all of this. But you can also make sure that when you measure it, you're also in control and know what to do before that to get an accurate measure. So I do realize that my measurement may also be off 10 millimeters of mercury because I am talking or actively listening as I am doing this. In my late 20s, even as an active, overall healthy adult, I am struggling with high blood pressure and cholesterol. The only reason I learned this was because I was working for the American Heart Association. I realized that I was telling everyone to know their numbers, but didn't know my own. My cardiologist encouraged me to purchase my blood pressure machine, and we've been monitoring it for about a year or so. My BP is under control and was likely just stress related, but you can easily purchase an inexpensive machine. And of course, as mentioned, it does not need to be anything but an upper arm monitor, not your wrist. An upper arm monitor will give you the most accurate reading. My cardiology group uses an app that helps me to track it. And as expected, I don't know if you can see it, but I am off because I am actively talking. I was at 131/95. So those things can make a huge difference in knowing whether you're in hypertension at all, stage 1, stage 2, or stage 3. So of course, tracking is very important to know if self-monitoring is accurate and helps you to diagnose it properly. The simplest method is of course just a good old pen and paper. You can track it in a small journal, or we can send you a link and you can download and print this blood pressure log. Or we also have a free online tool that allows you to set up an account and keep track of your numbers in a secure account and helps you to see those trends over time. We would simply encourage patients to click on create an account and use code 3 for our region. Other resources that are available to you, some as recent as Monday, which is very exciting. The validated device listing is the first US list of BP measurement devices developed to assist physicians and patients in identifying blood pressure devices that have been validated for clinical accuracy. Until now, healthcare professionals have had no convenient way to determine whether their patient's device has been validated. And with this recent increase in telemedicine visits, the need for accurate self-measured blood pressure readings taken at home has never been more important.
I'm Dan Lackland, and I want to talk about an exciting education program that we have for almost all healthcare providers that's focused in on hypertension. One thing over the past years, there's many certifications that individuals are able to take that kind of identify themselves as being a hypertension specialist or someone that specializes in hypertension, kind of a credential. These can be pharmacists, these can be physicians, nurses, physician assistants, just about anybody that's involved in some way with the treatment of hypertension and the management of hypertension. So we've set together an exciting, enduring program that this can be a part of, that's going to be readily available to you, that's delivered by the masters, the people that have written the papers, that have written the books, and have had a history of different aspects and the different competencies that are associated with high blood pressure. This is going to be very short segments that you would be able to access, be able to utilize, and determine what is the current information, again, prepared by the masters, prepared by the individuals that are so focused in on these specific topics, that you'd be able to apply this and pick up really what is that up-to-date information and what is the essential information that I need to do that's evidence-based, that carries through. This information is going to be readily available to you so that you're not having to leave or actually go anywhere. You're able to access this information very readily. And we think it'll be a very important component that you would be able to use.
So there's all kinds of learning modules, whether it's through Target BP or that lifelong learning that they were just talking about. but also wanted to share with you that there is an upcoming scientific sessions focused on hypertension. These international conferences are hosted by the American Heart Association on an annual basis, and they also move all over the country. So luckily, the next one focused on hypertension is in New Orleans. There is still an opportunity to register and even submit your abstract if you would like to present. There will be a virtual option, of course, but I hope you may consider joining us in September at the Hypertension Scientific Sessions. When you register for our outpatient services, please don't forget to submit. So here are those 3 outpatient services again. We have extended the deadline for that until September 4th. So when you register, you will have access to all the free tools and resources shared today, plus a lot more. Data submission is typically due at the end of May, but has been extended to September. This applies to all programs, Target BP, Check Change Control Cholesterol, and Target Type 2 Diabetes. You're able to opt in to one or all 3 programs and may receive recognition for your commitment to improving healthcare in Louisiana. We are now going to open it up for questions.
Yes, thank you so much, Chelsea, for sharing that information with us today. It's very helpful, and all the great resources that you have available. So yes, as Chelsea said, we'll now take some time to see if anyone has any questions. And as a reminder, we'll just type it in the chat box so that Chelsea can read that aloud and address. So we'll give a few minutes to see if there's any incoming questions.
I'm happy to address it as soon as any come in the chat box. We haven't had any in the chat box yet, but of course, just wanted to let you know that we are available if you have any additional questions. Myself and my coworker, Coretta Lagarde, are the health strategies team for Louisiana, and we focus a lot of our work on our outpatient services. So we are happy to answer any questions that may come up later. I'm still waiting for some to come up in the chat box, but if not, I'm very excited to have the opportunity to talk to you today, and thank you so much for your time.
Okay, I don't see any questions coming in through the chat box, but again, as Chelsea mentioned, if there are any questions or anything regarding the material presented today, please email Chelsea or Coretta directly, and they can follow up with you. So we want to thank you again, Chelsea. This was really some great information, some great resources that you shared. And thank you to all the WALPIN participants for joining us today. And please watch out for next month's webinar details along with other training opportunities and resources in the upcoming WALPIN newsletter. Everyone stay safe and well, and we'll see you next time. Thank you.